Hey, welcome to the show. I'm your host, Dr. Joseph Kappas, and today I'm joined by my guests, Dr. Meaghan Longyear and Dr. Meaghan Longyear. Thank you for joining me today.
Thank you for having us, sir.
Yeah, thanks for having us. We're excited.
Of course. And you guys are down in Jacksonville, Florida, right?
Yep. Yeah, we're down here full time. Just got down from Atlanta a few months ago. So yeah, enjoying some beach time in between patients.
Yes, not a bad place to be. So today I'm really excited to talk to the both of you about our topic of the combination of functional neurology and NET or NeuroEmotional Technique. But before we get into that, can you guys kind of tell us how you got into these particular fields and what got you interested in neurology?
Yeah, so NeuroEmotional Technique is actually what kind of brought me into chiropractic school. I had a student of my husband's actually work on me, and it was such a profound difference that I noticed in myself that after trying to find other doctors after we moved that could work on me and continue this healing work, realized that I needed to learn this so that I could help other people to get through, different anxieties and depressions and such like that. And since getting into chiropractic school and learning more about it, it's just amazing seeing how much of that ties into every area of health, and it's just kind of grown from there. So
yeah.
And for me, I got into chiropractic school because of an injury that I had when I was in high school. Playing football, I was injured. I was actually paralyzed for about a month. I was in the hospital, and they didn't think that I would walk again, but thankfully, physical therapist kept working with me, got me out of the wheelchair. And then it was a year later, actually, that I got adjusted for the first time by the team chiropractor in town. And I could feel hot and cold and pain sensation. So that wound me up in athletic training I went to school for, and then chiropractic school eventually. And when I got there, I needed to know what happened to me and why. So I just started studying a lot of neurology, fell in with some different teachers that focused in on that, and took the blue pill, so to speak, went all the way down the rabbit hole, and ended up, hardcore kind of in the funk neuro world with that stuff. And just working with some of the patients you see are just amazing. Some of the stories, as you know very well.
Yeah.
So it was a lot of fun. And then NET, we just started noticing when people would walk in the office, if they had a complex neurological condition, there was almost always an emotional component that went along with that. So, whether, if you have your MS patient, they kind of start to identify as MS. So their mood, their emotions almost become that disease and that condition. So NET was actually a way for us to break that thought process so that we could get them past feeling like they are that condition and allow them to heal more quickly and more completely with that stuff.
Absolutely. And I love your stories, by the way, because I feel like the best practitioners that I interview are the ones that have that personal connection to what they're doing. And you two definitely have that. So that's awesome. And so for those who aren't familiar with the term NET or neuro-emotional technique, can you kind of break it down and explain what it is?
Yeah, so kind of to start in with the functional neurology part of it, with functional neurology, we're really good at measuring physiology, or we have our little cues and things like that we look at for brain health. It might be focusing on eye movements or focusing on pupillary responses. And pupil responses, things like heart rate, oxygenation, those are all responses of physiology or how the body works. So it gives us cues as to, well, how efficient the brain is working. Well, when we look at NET, we're looking at the physiological part of emotions. A lot of people think of emotions as, oh, it's just how I feel, or I'm sad today, or I'm happy today. But the reality is there's often physiology that accompanies that. And sometimes even physiology that causes those emotional responses. For instance, if you're sad, or you're anxious, it'll do different things to your pupillary responses, but also your heart rate and those types of things. So NET is a way for us to go in and work with different parts of the brain to change the physiological response or the physiology of the emotions that that person is experiencing. You know, a lot of times you guys, I know, work with POTS and things like that in your office as well. A really high heart rate is anxious and anxiety. So sometimes we might even do NeuroEmotional Technique or this technique on something like that to remove that high heart rate or that flutter that they get in their chest can be an emotional trigger. It can send them into that kind of anxiety track. And now one kind of feeds the other and you end up just kind of winding up.
Yeah, absolutely. And what does a typical session look like, or how does the technique actually look for the patient?
So we use manual muscle testing to asking the body questions, but kind of looking for a response from the neurological standpoint. So we can do it one of two ways, where we ask a question like a statement, I'm okay with something. And if you test that you think, oh, I'm okay. Like I had a patient not too long ago that we did, I'm okay losing weight. She's been trying for months to lose weight and just can't. So we checked it to see if she was okay losing weight. And we checked the I'm okay statement, and she was completely blown away that I'm not congruent neurologically to be okay losing weight. What's the block there? What's the emotional, hiccup there that I'm not able to move forward with what my conscious brain is telling me I'm ready to do this? So being able to do the muscle testing, we can check also through the body entry points to see if there's, like a pain. Like we learn in school that, toxins, thoughts, and traumas, that this is how we can go about, starting to heal somebody and help somebody. And the thoughts part of it, this is, could be something we're storing in our body with like a stomach ache or something. If it's something that's not being resolved through, changing your diet or, doing certain neurological, exercises and stuff, that there might be an emotion that's hanging out there that's not able to, process through the body like it's supposed to. So usually sessions are about like 15 to 30 minutes, just kind of depends on, what kind of stuff comes up and, talking through it. And it's not so much talk therapy, but you obviously are talking when we bring up certain, aspects of, what was going on at that time, as we're, guided through the series of questions to kind of trigger in on what that emotional stick is, so to speak.
Absolutely. And you've alluded to a few different types of patients. One patient with difficulty losing weight, another patient, you mentioned MS a little earlier. Who really benefits from NET, and how would somebody know that NET might be a good treatment option for them?
Everybody needs NET.
Probably, yeah.
We all experience big traumas, little traumas, anything that we weren't able to process through because of if our environment was scary or there was a threat, depending on if you were a child and it was, a fearful, a car accident, for example, that you experienced, and you weren't safe in that environment to process those normal emotions that you're going to feel in something that makes you scared or fearful or, sad, grieving a loss of somebody or something. If we hold on to those and we're storing those, then those create what we like to call limbic loops. Mm-hmm. And that's held down in our limbic brain, in our deeper structures of the brain, our survival brain, as you know. And if that's in our subconscious mind. So it's not something that we realize that we're thinking about, but that part of the brain doesn't own a calendar. It doesn't own a watch. So what was happening to us at 8 years old is still happening to us in that part of our brain today. Mm-hmm. So things can trigger you to respond physiologically based on something that you're seeing today at 30 years old. Mm-hmm. That happened to you back when, it originally happened. And so it's the body's way of surviving, but it's not a healthy way. It's keeping us in that survival and that, not looking at the big picture and being able to, see life isn't threatening, that this is okay. We're going to be all right. So being able to break those limbic loops by doing NET, we're giving the patient kind of removing the emotional tie to that event that happened in their life. So it's more of just an event, and it's not something that's triggering a bad response that we, aren't responding in a healthy, positive, fruitful way.
Absolutely.
And I kind of look at it like this too. A lot of times if we bring it in, if it's not the primary thing that we're doing with somebody, it's a lot of patients that feel like they're stuck. Like they kind of, you know, they can't get past a certain point. They've gotten X amount of far in their treatment or in their rehab, and there's something still that they feel is holding them back. They're not really sure what it is, but it's something that, you know, maybe they're stuck in the same repetitive loop. Like somebody always kind of goes into the same pattern, or every time they walk into a certain store, that's when they get dizzy, or, you know, different things like that that seem to have some sort of an emotional component to it. You know, I often use this example when we teach, in that my dad worked at a grocery store when I was a kid, and we were up at the store with him one day. And this is an extreme example of how your emotions can kind of hijack your brain and take over. He got called up to the front because he was one of the bigger guys, and he worked in the meat department, so maybe they thought he was going to bring a knife with him or something. But there was an irate customer that was yelling and screaming and going nuts. Well, you know, you go by the guy or you hear him, he's yelling, "Charlie's coming, Charlie's coming." And he's crawling around on the ground like he's crawling through the jungle. For this guy, he was back in Vietnam. And what had triggered that was there was a bottle of pasta sauce that fell off one of the shelves and exploded. And that sound was similar enough to a sound that he heard while he was over there. So it triggered him right into that limbic brain. So it put him into, I mean, for him, there was nothing post-traumatic about his stress. He was currently living there in that moment. And we all have those triggers. We have those things, maybe not to the degree that he does, but, you know, think about a certain song comes on that'll remind you of a breakup in high school, right? Those are little things, little triggers, sounds, smells, little visuals that put us back into that limbic system. So anyone who's feeling kind of stuck, or, you know, we need to get a little better activation, or we need to pull them out of being in a repetitive loop. And you see that a lot, like even with brain injuries. We have a patient that we work with right now. He just repeats the same thing over and over again, right? So like one day he might just say motorcycle, motorcycle, and everything that he does is about motorcycle. So we do this technique and we go in and we can find out how to release whatever he's thinking about with motorcycle, and then he's no longer perseverating on that. So we can move past that. And then you see like the relaxing in his face, the relaxing in his body, and he starts talking to you, having more of a conversation. He's more engaged. So those are the types of things that I think really benefit from kind of working through those emotional channels, kind of a bottom-up approach, if you will.
Talking about the PTSD example, one thing I think of when I think of kind of limbic windups and this sort of thing is some studies I was looking at on EMDR, and how a lot of people with PTSD and these sort of things, they don't go into REM sleep, and then their sleep ends up deteriorating and lacking. Have you noticed that by using NET as, you know, an intervention to improve or kind of break that limbic kind of cycle, that sleep tends to improve and other things along those lines?
Yeah, so, and that's a great example. And we actually, with the NET, we sometimes will use a little bit of EMDR with it. And the reason being, you'll appreciate this, the side-to-side eye movements, even that happen in REM sleep, those are pontine, right? So it happens in the pons, that little middle area of the brainstem. Well, those are directly connected with the prefrontal cortex and the frontal lobe. So you're actually connecting that fronto-ponto-thalamo-cerebellar frontal loop, kind of connecting those parts of the brain. And that has to help with sleep, because from that aspect too, that side to side, that frontal loop is right where that suprachiasmatic nucleus is, which is where sleep is regulated through pineal activity and stuff too. So sorry, that was really nerdy, but
Perfect.
Something I like to talk about, obviously. But so when you get those side to side eye movements, or when you integrate the emotion, it allows for smoother eye movements. It's kind of fun. We'll actually watch somebody pursuing a target back and forth, and you know immediately when they process the emotion, because they'll have like a little intrusion and it'll be in the same spot, go in both directions. And then when you see their eyes smooth up, they stop looking at it and going, okay, I can't see that image anymore. I can't see that picture anymore. Yeah. So it's kind of fun to see those two things and those two parts of the brain really integrate. And what I think is happening, you know, Doc kind of alluded to this earlier, is we're connecting that subconscious or that emotional part of the brain to the cognitive part of the brain. Emotion or cognitively, you might know you're okay with this and that you're safe, but emotionally, subconsciously, there's still a little bit of that fear. And so the subconscious kind of rules the day, even if you consciously know you're okay with it. And what the technique does is it kind of bridges those two areas of the brain together to allow you to more consciously get over it, so to speak, or get past certain things.
Okay. That reminds me, there was a research study that I think we had talked about in the past. I'm not sure if it's been published yet or if we can talk about it here, but talking about looking at DTI images of the brain before and after an NET session.
Yeah, it was actually functional MRI. So
that's right. Yeah.
Same thing, different algorithm. I don't know that they had the DTIs actually done, but yeah, they did functional imaging of the brain with cancer patients. So they actually took, I think it was 20 or 22 cancer patients, and they had them write the story of when they got diagnosed with cancer. And then they read them the story and asked them to rate it 0 out of 10 in severity of how emotionally traumatizing it was. So you can imagine for a cancer patient, that initial, I'm sorry to tell you, the scan showed you have cancer, that has a really kind of big impact on them emotionally. So they put them into a functional MRI and they measured their brain while they were being read that story initially. And what they saw was all sorts of limbic structures lighting up. So things like the parahippocampus, the amygdala, which we'll talk about in a second, and all of these kind of deep brain structures, or these brain structures that are just responsible for survival. Then they did the technique with them, and they did the technique until they got down to a 2 out of 10. So originally, most of them were like 8 or 9 out of 10. And they did a technique to remove the charge, so to speak, of the event. And then they put them back in the fMRI and they read them the story again, and they saw different areas of the brain light up. So no longer did those deep structures like the amygdala, the parahippocampus, they didn't light up anymore. But what did start to light up now was the prefrontal cortex, where you can reason things and make sure everything's going to be okay. The anterior cingulate lit up, actually, which is responsible for reward and those types of things. And then another part of the brain that's kind of my favorite lit up in the cerebellum. So it really showed a tie to the cerebellum, which we classically thought of was responsible just for like balance and coordination, or being able to do a one-legged stand or touch your nose. We started to understand quite a bit more with that. And then that actually kind of tied into the research that came out in 2018. And that paper, by the way, by the One Foundation, was published in a cancer magazine, Cancer Survivors magazine, which is I guess the #1 cancer publication for cancer treatments. But then the research has come out now too on the topography of the cerebellum. So they've done, with current science now, they have improvements in technology that we can actually do a QEEG on the cerebellum. There's 2 machines in the world, one's in Canada, another one over in Europe. They were actually able to image what happens in the cerebellum during different events or during different things. And so they actually remapped the cerebellum, and what they found was only 20% of it did what we thought it did. And that's a one-legged stand, or, moving smoothly and not having your hand or motion break down. But 80% of it was actually responsible for balancing and coordinating your thoughts and your emotions. So those 2 pieces of research together really kind of, I think, flipped emotional research on its ear a little bit and changed the game big time for the way that we think about the brain. And not only that, but classically, we always thought of mental health as a trauma issue, or, an issue like something bad happened to me in my childhood, therefore I have depression, or therefore I have X mental health condition. And some of that is absolutely still a thing, right? That it's multifactorial, but it changed the game a little bit and focused mental health on brain function and brain physiology too. And so we know that we can, make brain changes in people, and that if we make those brain changes and we rewire the brain, so to speak, we can have positive effects on that emotional health or that mental health, and not just the physical stuff and the physical manifestations of what we see.
It's fantastic. I know in our office and in your office, we look at in the integrity of the cerebellum pretty in depth, especially the motor aspects. Have you found that by working with your cerebellar, working to improve the integrity of the cerebellum in certain patients with emotional dysregulation, so to speak, that you've been able to improve those aspects of their life in addition to balance and coordination? So just by doing your functional neurology rehab strategies?
Yeah, and that's kind of, so we're doing some research at Life University with the research department, and then the other clinic that I work with, the NeuroLIFE Institute. And what we started to find was if people came in with a neurological condition, let's say it was a balance disorder or a tremor or like a dystonia or, traumatic brain injury like concussion, those types of things. If they came in and they couldn't do a one-legged stand or they couldn't smoothly touch their nose, they also scored really poorly on a questionnaire that we use in our office called a DASS, which stands for Depression, Anxiety, and Stress Symptom Score. And what we realized was really cool was when they can do a one-legged stand better, those depression, anxiety, and stress symptom scores also got markedly better as well. So by working through the movement patterns and cleaning those up, we saw huge changes in their emotional well-being and their mental health as well. And they reported it too. And I'm sure you guys get this. One of the first things you hear from patients is, and it's usually not from the patient, it's usually from their family member, is, my kid's back. Thanks for, this is the first time I've seen him like this. He smiled for the first time in 3 years. Thank you so much. And that's the first thing you really start to see change. And then you see all of these other things kind of clean up, right? Mm-hmm. So I think the emotional well-being and that affect, if you will, changes first and foremost as you build those areas of the brain. And then you kind of get it on the back end as well with other signs and symptoms of things that happen.
Yeah, that's fantastic. Yeah. And I guess one of the questions I really wanted to ask, but we've really kind of touched on a lot so far, is how you are pairing NET with functional neurological rehab strategies. We talked about how you're looking at eye movements as well as the cerebellum. What other ways are you really trying to, I guess, compound the effects of the two together with your patients?
So, when we do the NeuroEmotional technique, what really got me into it was the science in it, right? So you've heard of amygdala hijacking, and I think that's kind of the easiest way to explain this part of it, how we get to using it with the different things. The amygdala is like this little almond shaped or sized piece of matter in your brain, and it's your fear centers. When we fall into these limbic loops, so to speak, or when we fall into these patterns and have these emotions kind of running us, if in NET, it's called a neuro-emotional complex, or an NEC. I kind of refer to them as limbic loops. But anytime you've got that kind of movie playing in the back of your mind, what happens is your amygdala hijacks the brain. And what I mean by that is it forces blood and resources and nutrition to those deeper structures. And when you do that, what I was finding was it was really hard to get in there and exercise the cerebellum or exercise the frontal lobe when all the resources were being pulled internally. And I might, be able to exercise it, but then as soon as that song triggered them again, or that visual triggered them again, it put them right back into where they were. So the way that we incorporate it is, if I know that's a component, that emotional thing is a component, we'll do some NET on them to start. And then that allows us to go kind of exercise their prefrontal cortex or their cerebellum or the right parietal lobe or whatever the higher centers are that we want to activate. Mm-hmm. And then, immediately after coming out of an emotional session, we put them right on a balance board too. Or we'll have them do some mirror writing or have them do something that's really hard physical cerebellum to help us kind of break that. And wind all of that stuff in together. So we essentially take and cut off the tie or the draw to all of that blood and resources to the bottom brain. And then when we get them out and we exercise them afterwards, we're forcing all of the blood to go to those areas. So what we've found is that combination really has kind of a cool effect with a lot of different conditions in speeding up some of the rehabs and stuff.
Yeah, very cool. So I'm always interested to hear, success stories and kind of these great cases that, you're sure to have. Do you have any that kind of stand out in your mind that you just love to share with our audience?
Oh, geez, how much
I got a
time do we
couple.
have left? I have so many. So probably my most favorite, the sweet girl that I used to work with, that was referred to us to. She was in her 20s and having issues going out and being normal 20 something, hanging out, partying with her friends. She would have such horrible dizzy spells that she would pass out. She'd have to call someone to bring her home and couldn't drive anymore. And that is just no way for anyone to live, but yet alone, not being able now to go to school and be out and be social.
Mhm.
So she was, obviously getting her neuro rehab, and we started doing some NET with her, and realized that there had been some big things that had happened in her recent past that were, completely stemming to this emotional breakdown. Now, she didn't understand this shit when we first started working, that every time that, this topic would come up, boom, I'm, having my dizzy spells and having all these problems, and I can't function in my life.
Mhm.
So we worked on her for probably about a month, and really we're doing a lot of NET, trying to do 2 to 3 sessions a week if possible. And then, like Dr. Mike was saying, really getting in on the, balancing and working on her frontal lobes and cerebellum. And within like a month, she was back out with her friends, and she was, living life again.
Yeah.
And so, we still continue to work. People have traumas that happen that, you don't, it's just not a one and done. It's not like you have just one thing happen and we're just going to do one magical session and everything's gone.
Yeah.
We're always, doing work to help, improve your health and improve your thoughts so that you can be the best version of yourself. But now she realizes the connection, that if something does come up around that traumatic thing that happened to her, and she starts noticing her dizzy spells, as soon as, she puts that connection together, we've given her tools that she can do things at home. And then, we keep up with our sessions. So it was so wonderful seeing her transformation, going from completely crippled to being able to go out and be her happy, joyous, perfect little self that she, that she is. So that was my favorite one. I could tell I probably got like 7 or 8 of them that I could tell. I get excited about success stories.
And that's so rewarding, especially to see such a quick improvement in such a little time, and now she's back to her normal self.
Yeah.
It's fantastic. Yeah.
There's lots of crying in our office. You see people getting their lives back, people that just didn't think they'd ever get beyond this. And it's like, there's hope. There is hope, and giving somebody hope that they can, get back to, or even be better than they were before. Like, that's just amazing. That's such a blessing.
Absolutely. Yeah.
What's your favorite?
We had a really cool patient come down from Canada, and this one always sticks in my mind with the emotional stuff. She had some pretty severe agoraphobia, meaning she wouldn't leave the house on her own. She would leave if her husband was kind of holding her hand, or if her daughter or son would walk her out. If you snapped your fingers, or if you threw anything at her or anything like that, she would have what they were calling these really intense pseudo seizures. Her head would violently shake back and forth. And it all started after a car accident that she got in, and I'll try to give the quickest version of this that I can. She was in a really bad car accident, and she woke up to the paramedics kind of snapping her fingers, saying her name repeatedly over and over again. And then she kind of came to. The next thing she remembers is she's in the hospital, and the doctor, wakes her up, and, they're starting to talk to her. And the first thing she asks was, did the other driver make it? And the doc looks at her, and there was also a police officer waiting to take her statement as well. And the police officer kind of jumped in and said, "No, ma'am, he didn't, but that was his plan. We found a suicide note in his car, and he was there on the bridge that night, and he chose you to drive into to take his own life." So you can imagine kind of emotionally what that did to her. Yeah. And as we did some NET and some neuro work, we uncovered some other things around it as well. But, the snapping in the fingers took her back to violently rolling over in her car. So that's where the pseudo seizures were coming from. Things coming at her was that guy's car coming at her, right? So her emotional reality was such that it was taking her back to those things.
Yeah.
So we did a 2 weeks we had her. And after 2 weeks, she was able to walk outside across the street from the office, walk down to the soccer field with a soccer ball, and all by herself while listening to a metronome beat at 54. So that was kind of a grounding frequency or beat for her. And then when she got down to the bottom of the field, she called for her family. Her daughter and her husband were there with her. And they actually played soccer, kicked the ball around and all sorts of things. What she didn't realize until she got back was the 54 beats a minute was me snapping my fingers to 54 beats a minute. It wasn't the same metronome that we were using. So she had kind of conquered her agoraphobia, the snapping, and the things flying back at her, all by removing some of those triggers. And I mean, obviously, when she heard that it was me snapping my fingers, she lost it. But that wasn't setting her off anymore.
Yeah.
If you've ever been to my office, I walk around kind of doing this all day.
Just to see.
It was really hard to stop that because, you know, we had a student that was in shadowing at that time, and he didn't know the snapping of the fingers. So he was putting her on the CAPS, the balance platform that we were using. And he snapped his fingers when he got her on there, like, all right, we're good, let's go. And she immediately went into it. And it was cool to see that she was able to not do that. And then she got home and she rode her bike to the grocery store and was doing all sorts of stuff on her own. That was really cool to hear.
That's an amazing story. And again, in such a short amount of time too, that you're able to make such a huge impact on this person's life. Now, obviously, we are in the middle of a very stress-inducing time in the world. Hopefully, by the time this episode comes out, things will be looking a little more normal. But what would you have to say for those who might be struggling from maybe an emotional and a mental state right now? Because this is such a trying time for so many people.
Definitely recommend NET. We've been telling our patients, the ones that still come into the office, that they need to get NET done. We need to be doing work around this. Because of the time that we've all been so distant from each other and whatnot, it's going to take some transitioning to get back into, you know, being out there around people again and not feeling that fear now that, you know, that we've captured of, could somebody, you know, have something that could make me sick, and all these thoughts and all the stuff we've heard on the news. So by, you know, finding somebody that does NeuroEmotional Technique, if, you know, by you, there's, you know, contact our office. I'd be more than happy to, you know, refer if there's an area that people are at, but this is extremely important to be able to not stay in that fear center, that everything is a threat, that somebody might be making me sick, to have all those thoughts that we've been hearing now for the last 6 weeks, to really start working through that and disconnecting that and being able to get into the higher centers of the brain so that we can look at this world is okay and we're going to be all right, and see the bigger picture so that we can all be healthier and get back to a good functioning way in life. Yeah. So yeah, it's taken its toll on people. I mean, you can see it, you know, in the grocery stores, you know, some people with masks and some people not. And, you know, that we got to do some work to work through that and, you know, give people tools to help them so that they can get back to living less fear, more love, and being healthier for it.
Yeah. Yeah. I imagine your office is just going to be slammed after this is all over, you know.
Well, I think phase 1 is kind of the virus time, and phase 2 of this is going to be the reintegration. You know, it's going to be a while. People are going to have PTSD to coronavirus. Yeah. We're already seeing people have PTSD and emotional responses to masks. You know, some people, it's interesting, you know, if you're out in the store, we saw somebody the other day went off on somebody that was wearing a mask because their, you know, view of this whole thing was maybe that it's not such a big deal. And the person with the mask obviously thought it was. And I think that's the polarizing part of this, is there's two very different opinions on this subject, all walking around the streets together. So people have these emotional reactions or these emotional responses to people, and it's not even knowingly, you know, like I go out, I feel like I'm diseased because I'm looking at all these people wearing a mask, or, you know, the person who's wearing a mask, I feel like they just don't care, you know, they want to get everybody sick, or they're attacking us. So both of them have this kind of fear mentality that it's going to be a while, even once they do kind of, you know, loosen the restrictions and we get back to things. We're gonna need to pay attention to mental health. I mean, mental health was already the #1 prescription worldwide. You know, more than heart disease, more than all those things. And even at that, in the first few weeks of this, in a 2-week period, they saw more antidepressant medication scripts filled than they had in the previous 3 months.
Wow.
So mental health issues were and are climbing very rapidly. That's probably the #1 thing we get messages about, you know, personally or on Facebook, things like that is, you know, what can I do for mental health if I can't go outside? You know, and the answer is get sun in some way, shape, or form, get movement in, talk to family, all of those things. We need those things to really have an impact on our brain and our health.
Yeah, absolutely. Very well said. And I agree 100%. So yeah, hopefully people listen to this and take it to heart and find practitioners like yourselves in their local areas and really get, you know, the help that they will probably need after all this is over. But yeah, but I wanted to make sure that we had enough time at the end in case we forgot to mention anything throughout the show. If you know, we may have left anything out, or if there's anything else about NET and functional neurology that you'd want to mention.
I think I'm pretty good. I think you did a really good job kind of pulling what I wanted to talk about out of us. So
yeah, the only thing I think I would throw in there about NET, a lot of, I want people to understand that there's nothing wrong with emotions. There's nothing wrong with feelings. And though a lot of us, you know, were raised or, you know, knew people or friends with people that, you know, we shove our emotions down and we don't deal with them and just leave them. It's safe to do this technique. It's a safe environment. And that's what I love so much about it. Men, women, children being able to come in, but we're going back to a time that was stressful to you and putting you in a safe situation. You're in a safe environment and being able to process that, and seeing some of the biggest like skeptics to this kind of work because, well, I don't want to feel things and don't, you know, leave those emotions alone. And to seeing them let go and release, it's not always, you know, I hear this a lot from patients. Well, I don't want to cry. I don't want to come to your office and cry. Well, not everybody cries. Some people just, you know, let other ways out. They just sweat a lot. They let that energy out, that emotion out, however your body's going to do that. But the point is you're letting it out, and you're not letting it sit in there in your body and harbor into something that could cause something, could, you know, make for your future not to be as bright and wonderful as it could be, because you're holding on to something that's not serving you. So it's a great technique for anybody, any kind of trauma, the littlest of things, the big things, but to be able to, you know, allow yourself to have that component of healing and just give it a try and see where your life goes from there. By being able to just let go of some things that, you know, you don't even realize aren't serving you, but are playing like little movies in your mind over and over again.
Yeah. Well, that actually, you saying that spurred on another question for me, if you have the time. But you said that people are often harboring these emotions for, you know, a long time. And, you know, if they hear some type of trigger, they may be stimulated. But if you're harboring these kind of negative emotions for years and years, is there any correlation to other types of chronic diseases that people may develop later in life? I'm not sure if there's any research that's looked into that specifically, but.
Well, so I think there's a ton of research. I'll bring up a guy by the name of Hans Selye. who's known as the father of stress. It's a horrible name to have, but he did something that I think was groundbreaking, and for a long time we've kind of ignored it, and I think we're starting to get back to it now. In the 50s and 60s, he was in med school, and he was sitting in the back of the room, and at that time in the 50s and 60s, they would wheel a patient in a gurney, or on a gurney, and they would describe the patient, they would describe all the symptoms, and then the students would have to kind of give their differentials, right? Their differential diagnosis. And what Hans Selye realized was, sitting in the back of the room, is there was these common threads, whether it was diabetes that walked in or rolled in, or heart disease, or whatever it was that came in, neurological conditions like seizures. He noticed these kind of core set of symptoms and these core set of things that were at the beginning of all of these conditions. When they would do the history on these patients, they were finding all of these things. And that's where a lot of our questionnaires were born from in chronic illness. Things like the Adverse Childhood Events Questionnaire, or the DASS, or some of these other things. They were all born out of his work and what they were doing in those times. They realized that stress, distress, because there's different kinds of stress. There's stress that makes you sharp and makes you good, and then there's stress that makes your body break down, is actually the #1 contributor to chronic disease and of chronic disease. So when we talk about things like heart disease and diabetes and those things being lifestyle diseases, what we mean by that is exercise, doing meditations, doing things to keep your mental and physical health good, improve your lifestyle, therefore remove the risk of those chronic diseases. So things like depression, one part of it might be adverse childhood events and the stresses, and another part of it is that makes you kind of sit more and you're not as active, so now you don't get the physical activity in you either, so you end up with more chronic disease, and you end up with more depression, more anxiety, more of all of those things. So I think the research was done a long time ago, and now we're really understanding how it impacts our world and our society as profoundly as it does. As you see these things about the cerebellum coming out, these different techniques like EMDR, NET, brain spotting, all of these different emotional techniques that are working on those things and trying to get to the core of that stress.
Yeah, absolutely. And thank you. That was exactly what I wanted to hear. So for those who are now interested in NET and you two as practitioners, how would people find more about you and your clinics as well as your social media presences?
Absolutely. We've got our Facebook page, and we're on Instagram. By all means, can reach out, go on our website, www.brainoi.com. and send us an inquiry, send us a question. We get questions all the time, especially lately, about, how do I deal with all this emotional stuff that I'm dealing with the fear of looking at the TV and all this, coronavirus and stuff, as well as, obviously going into like traumatic brain injuries and working past, a place that they maybe have gotten like kind of stuck and need to get over that and move forward. So our website, we're on Facebook, Instagram, Brain Optimization Institute is the name of our Jacksonville location.
Awesome. Very nice. Well, thank you again, Drs. Longyear, for being on today. This was a fantastic episode, I thought, and I'm excited to get this out there.
Thank you so much for having us. We appreciate it.
Yes, thank you so much. It was great chatting with you.
Great chatting with you. And then from your host, this has been the Neuro Wellness Podcast. Be well.